Swastiastu. We are from SGD B1 from Analysis Category 2020 fourth semester. In this occasion, we would like to present our student project with the title Fat Malabsorptions in Irritable Bowel Syndrome. My name is Chandra and I will start the presentation. Next. These are the members of our small group discussions B1. Next. These are the points of discussion. Next. And now I will start with the background. So irritable bowel syndrome is one of the most common GI diseases and is defined as the presence of abdominal discomfort or pain and changes in bowel habits. IBS is a multifactorial disorder with stress and diet as the contributing factors. The mechanism that contribute to the symptoms including inflammations and gastrointestinal dysmotility. The ones commonly affected by IBS are adolescents and young adults. On the other hand, malabsorption syndromes are syndromes that may occur due to any defect in the process of digestion or absorptions. Common malabsorption syndromes is fat malabsorptions, and these malabsorptions may result of the appearance of fat in the stools. The symptoms that may occur are abdominal pain, nausea, vomiting, and diarrhea. And in the student project, we will discuss more about fat malabsorptions in irritable bowel syndrome. So these are the statements of problems. Next. These are the purposes of the study. Next. And these are the benefits of the study. Next. That's all for me. The presentation will be continued by my friends. Thank you.
Okay, my name is Bagus Manuaba with a 3-digit number 210, and I'm going to explain about the definitions of fat malabsorptions. The ability of the GI tract to digest and absorb fluid, electrolytes, macronutrients, and micronutrients is critical to sustaining good health. There are 3 processes to nutrients absorptions: the luminal and breast-border processing, absorptions into the intestinal mucosa, and transport into the circulations. Intestine insufficiency or deficits is defined by the European Society for Clinical Nutrition and Metabolism as a decrease in gut absorptive activity that does not necessitate intravenous supplementations for health and growth maintenance. Malabsorptions is impaired nutrition absorptions caused by any disruptive and in the normal absorption process. The liver, pancreas, stomach, intestines, and small bowel can all cause malabsorptions. Next.
Okay, I will to continue the presentation. My name is Kirana Devi Savita, and I want to explain about the definition of IBS. So, irritable bowel syndrome or IBS is chronic gastrointestinal system disorder characterized by abdominal pain or discomfort, bloating, and change in bowel habits. Based on the room 4 criteria, IBS is characterized by recurrent abdominal pain associated with defecation, change in bowel frequency, or change in stool form at least once a week for the past 3 months, with symptom onset at least 6 months before diagnosis. IBS is classified into 4 types based on consistency, namely constipation dominant IBS is IBSC, diarrhea dominant IBS is IBSD, IBS with mixed bowel habits is IBSM, and the last is IBS that cannot be classified is IBSU. That's all for me. Thank you.
Hello, my name is Winata with 3-digit student education number 061. For the continued presentation, in this section, I will cover about method of journal searching. That in this paper, we perform literature review with the literature reference are from relevant journals such as PubMed, ResearchGate, Google Scholar, and Science Direct database. Research with the following keyword like fat malabsorption, IBS, digestion, absorption, recommendation, daily intake, risk factor, and nutrition. We use the following criteria for inclusion. Number 1, studies will be at least in 10 years publication and published in English or Indonesian language, and we chose to exclude publications that are experimental studies. From 532 journal articles that we are reviewed, we chose 29 journal articles that we appropriate as a reference for this paper. Here are my presentation. Thank you.
Okay, hello. My name is Stevanus Surya, with last three-digit number is 150. So now I'll explain about the digestion of fat. The fat digestion process begins with an emulsification mechanism in the oral cavity through mastication mechanism and hydrolysis by the lingual lipase enzyme. Start by lingual lipase will undergo an agitation process that aims to mix the fat with the gastric lipase enzyme in the stomach. The product of digestion migrate from the stomach to the duodenum of the small intestine, which triggers the secretion of the hormone cholecystokinin and secretin by the cells of the small intestine. Most of the emulsification process of fat occurs in duodenum with the help of bile, which consists of two components, namely bile salt and lecithin. This process will facilitate further digestive mechanisms that are facilitated by pancreatic lipase, which play a role in converting emulsified fat into micelle. That's all from me. Thank you.
Hello, my name is Damaghita, so I will explain about the absorption of fat. So the absorption process starts when micelles, which contain monoglyceride and also free fatty acid, are transported into the membrane of enterocyte cell in the small intestine. It will be diffused inside to the membrane. So when the monoglyceride and also free fatty acid inside the enterocyte site, monoglyceride and also free fatty acid will be reattach each other and reform triglyceride. This triglyceride will gather with other types of lipid, such as cholesterol, and wrapped by a protein, which will form a lipoprotein named chylomicron. And chylomicron will be entered into the lymph capillary and are transported along the lymphatic vessel into the bloodstream. Once the chylomicron reach the bloodstream, it will be transported to liver, muscle tissue, fat tissue, and other tissue, where they can be metabolized by the cell into energy or stored inside the cell. Thank you.
Hi, my name is Chandra with last student number 102. I will continue with recommended dietary allowance. So the first step in determining nutritional needs and modification in IBS patient are by assessing their eating pattern and diet. It is indicated that patients with IBS tend to adapt to their diet according to what the patient thinks or believes to be the culprit of the symptoms. However, this behavior may lead to a complete elimination of a certain diet, risking nutritionally deficient condition. The first-line modification of the diet, including alcohol intake reduction, caffeine intake reduction, spicy food intake reduction, fat intake reduction, dietary fiber intake, and milk intake. The first one is caffeine intake. For IBS patients with symptoms related to caffeine, consumption are limited to 400 milligrams of caffeine. Although the role of caffeine in IBS is not entirely clear, it is shown that caffeine coffee increases colonic motor activity and gastric acid secretion in healthy subjects. Coffee have also been shown to promote rectosigmoid motor activity, resulting in a laxative effect in those who are sensitive. The next is spicy food. For IBS patients with symptoms related to capsaicin consumption should be restricted or eliminated. Capsaicin stimulates the tyrosine receptor potential phenyloid type 1, TRPV1, which causes burning and painful feeling in healthy people, and in a certain individual which have higher sensitivity, such as IBS sufferer, may be the culprit of the patient's symptoms. The next is dietary fibers. For IBS patient, there is no determination which the proper consumption, but it is recommended to intake around 20 to 30 grams of dietary fibers. Patients with IBS-C should be advised to try dietary supplementation of linseed of up to 2 tablespoons per day and consume with patient with IBS-C should be advised to try dietary supplementation of linseed of 2 tablespoons per day consumed with fluid. That's all for me. Thank you.
My name is Amadeus Fernandito Leksana, and I will continue the presentation. So the the next line of modification are fat intakes. So fat intakes for IBS patients should be examined if IBS symptoms occur before or after eating, while ensuring that the intake is in line with healthy eating guidelines. According to FAO or WHO, dietary recommendations, an adult's total fat consumption should be between 30% and 35% of total energy, but not less than 15% of total energy. And people with IBS should be encouraged to reduce fat intake to no more than 40 until 50 grams per day. Okay. Next one is about the milk and dairy products intake. So the milk and dairy products intake for IBS patients should be instructed to adopt a low lactose diet only if they have a positive lactose hydrogen breath test. If the patient chooses a low lactose diet without proper test, patients should be informed that there is no high quality evidence that a milk-free diet would help their symptoms. In addition, patients should be informed that a milk-free diet may result in a low calcium intake, increasing the risk of not meeting daily calcium requirements. In patients with IBS who have a milk sensitivity and a lactose hydrogen breath test is not available or appropriate, a low lactose diet should be tried for a period of time. Okay. So next one is about the risk factors related to fat malabsorption problems in IBS. The first risk factor is female sex, in which incidence of IBS in women is substantially higher than in men with a 2 to 1.5 ratio. Second one is younger age. With increasing age, the incidence of IBS likely reduced. Then psychological comorbidity, because the central nervous system can modify gut physiology, such as motility or visceral sensitivity. Patients with psychiatric comorbidities such as stress, anxiety, and depression are frequently associated with IBS. The next one is post-infection IBS. Patients with acute or infective gastroenteritis caused by Campylobacter sp, Escherichia coli, Salmonella sp, Shigella sp, Clostridium difficile, Vibrio cholerae, norovirus, and Giardia lamblia are commonly referred to PIBS. Generally experience looser and more frequent stools rather than constipation. Okay, that's all from me. Next one will be presented by my friend.
Okay, thank you, Amadeus. My name is Bertrand Wijaya with 3 last digit number 132, and I'm going to continue about the risk factor. Next is genetics. Many IBS patients report having relatives with the same diagnosis or symptoms, and studies have also revealed family aggregation of IBS, implying a genetic component. Next is dietary factors. Dietary causes for IBS symptoms are frequently reported, especially in the Western diet, which is heavy in sugar and fat. Reduced quantities of FODMAPs in diet have been reported to improve symptoms of IBS. And gut microbiome. Patients with IBS have a different fecal microbiota than healthy individuals, which may influence colonic transit and cause bowel irregularities. That's all for the risk factor of IBS. Thank you.
Hello, my name is Alamanda Candra with 3-digit student ID number 086. So I'll explain about the nutritional approach for fat malabsorption in IBS. So inflammatory bowel disease or IBS, nutritional approach has first line and second line. The first line approach focus on diet and lifestyle advice for dietary management in IBS. The classic recommendations are having regular eating habits and restricting the intake of possible dietary triggers such as spicy foods, alcohol, caffeine, lactose, and fat, as well as adequate fluid intake and regular moderate physical activity. So the low fat intake in fat malabsorption in IBS patients should be maximum 50 grams per day and substitute with healthy fats such as olive oil. So the second line nutritional approach in IBS is a low FODMAP that stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet. So FODMAP diet is a group of short-chain carbohydrates that poorly absorb, so they ferment rapidly, leading to gas buildup and eventually increasing fluid inside the intestine and diarrhea. So the low-fat FODMAP diet should be done in a short amount of time. In most of study, less than 4 weeks, because it can affect luminal microbiota and concerning intake of fibers and calcium. So that's enough from me. Thank you.
Hello, my name is Putu Devi with 3-digit number 002. I will continue the conclusion. Fat malabsorption is a common malabsorption syndrome with a result of steroia and also affect the malabsorption of fat-soluble vitamins such as vitamin A, D, E, and K. IBS is a chronic disorder that affects GI tract, in which the main symptoms include recurrent abdominal pain with defecation sign and followed by bloating and changes in bowel habits such as infrequency or form, at least once a week in the past 3 months or 6 months before diagnosis. The digestion and absorption of fat in human process in GI tract with the help of enzymes, hormones, and other mechanisms. The first line modification of the diet for IBS patients includes reduce or limit intake of caffeine, alcohol, and fat, restrict or eliminate intake of spicy food, increase intake of dietary fiber, and change into a low lactose diet. Risk factor related to fat malabsorption in IBS patients include female gender, younger age, physiological comorbidity, post-infections IBS, genetics, dietary factors, and also the gut microbiome. The first line nutritional approach focuses on diet and lifestyle advice for dietary management, and while the second line nutritional approach in IBS is a low FODMAP, or fermentable oligosaccharides, disaccharides, monosaccharides, and polyols diet. Okay, next. So this is the references that we use to make our student project. Next. So that's all of our presentations. Thank you for your attention and have a nice day.